due process.
This situation significantly led to the twin problem of
the breakdown of the amount established to have been stolen and laundered.
What the federal government is doing is to provide
quality health care for Nigerians is not a question of privilege, but a right to the citizenry. And so it behoves on the government to provide an enabling environment, and of course, in terms of policy formulation, deliver quality, good, basic health care. The question is, are Nigerians actually getting what they deserve? Let's meet the Honorable Minister for Health. I'm talking about Dr. Osage Ehanire. You're welcome, sir.
Thank you.
What is the ministry's health policy and implementation master plan, or we possibly call it a roadmap for the health sector in Nigeria?
First is to say that we are targeting universal health coverage. One of the problems we have had in this country is a poorly structured health system, which we are looking at setting up right now under this administration. Primary healthcare center available per political ward. You have to make healthcare accessible, affordable, and acceptable to the people. And the quality must be good enough to give them the confidence to accept your healthcare.
Since you came on board as the minister, to what extent has the ministry under your administration ensured quality assurance, such as setting up of standards for the ministry's personnel, health facilities, and of course, health infrastructure?
I have said that it is universal health coverage we are pursuing. That means first increasing the coverage. How many Nigerians have access to health care? The second thing is how many Nigerians can access health care without the devastating out-of-pocket cost. Now, I have spoken of the primary health care per political ward, where we intend to upgrade the primary healthcare center, make sure it has solar-powered light or any other source of lighting. And also we have water supply and a staff quarter. Once you have that, you have a platform for reaching a whole community. And if you have a large ward or a heavily populated ward, you can have 2 of those centers. This will bring healthcare coverage by this administration's projection to 80% of Nigerian citizens, and reduce all those horrendous figures that you hear coming from Nigeria on maternal mortality, which is about 54,000, child mortality, which is about 800,000, other deaths from other areas which are really preventable. The second is to increase the quality after the accessibility. The quality by training more health personnel, more nurses, doctors, and health technicians in all areas, and providing the equipment and the organizational structure that makes it possible for people to trust the care service. And then the question of affordability. Right now, only 5 or 6% of Nigerians have access to healthcare through an insurance cover who do not have to pay. We want to, by 2030, if all things go well, because we have a bill that still needs to be signed into an act, be able to offer health insurance to 70 to 80% of the population, so that there will be no need for out-of-pocket payment. By that, you make the healthcare available to a large population, and by that, you're able to attend to many of the ailments that presently leave the population helpless. Also provide a pool of funds that will cover the provision of that service to citizens.
Manpower development, we know, is a major core mandate of the Ministry of Health. But the Nigerian health sector is presently witnessing an unprecedented massive migration of doctors and other health professionals abroad, searching for greener pastures. This is actually due to industrial actions and face-off with the government. What are the short and long-term solution-driven efforts your ministry is exploring to check the situation? We have a situation where a Saudi Arabian government actually came into this country recruiting our own doctors. This doesn't send a good signal at all.
No, it doesn't, and we are very disturbed and worried by it. But I would like to correct something, that this is not new. They have been recruiting, and when I say they, I mean the Middle East. But also European countries and the United States have been crying out recruitment here since the 1980s. The second thing is that it is not limited to Nigeria. There are many countries in Africa, particularly the English-speaking countries, which some of these developed countries see as a reservoir to recruit doctors. First, because it's very expensive to train doctors, and many of these countries I'm talking about now, which include India, Pakistan, Ghana, and Kenya, and so on, and Uganda, train their doctors at highly subsidized rates, and they have the quality of manpower. Also, the fact that the English language is there, because you naturally, as a doctor, you are dealing with people. Finally, it's not restricted to doctors. They do come here to take nurses and so on. I have asked that question also, informally, of one person from a developed world. And the complaint is that even in the UK, for example, they complain that they're losing their doctors. Their doctors are going to Canada, to Australia, New Zealand, where they believe that the remuneration is better than the UK, and that these doctors have to pay back the cost of their training, because as you know, in UK, there's really nothing like a scholarship. You train with student loan, and if you want to leave, in fact, while you are working, you refund the money with which you are trained. And then they also have attrition going to other countries. When they lose their doctors, they go recruit from somewhere else, because it's expensive and takes 6-7 years to train a doctor. It's a cycle that is going on globally. Although we are lucky to have more and more doctors being trained here, there are more and more medical schools springing up. We are training more and more doctors. We're also fortunate that some Nigerians who were trained abroad are also returning to the country, because they probably think they have a better opportunity here, or they want to be near home. So it's a two-way movement you are seeing. Just recently, we were able to induct nearly 900 foreign-trained Nigerians who have passed the test here and are entering the system here. We are going to be monitoring the situation very closely, and seeing how the balance turns out. And from there, we shall look at the actions that will favor our country and favor our health system. We are working with all our consultants, who are senior doctors at this time, who are mostly also here. They are not the ones living, mostly junior doctors, resident doctors, to go back and roll up their sleeves and do more than they're doing now. Also to activate all the doctors who are doing youth service and the doctors who have just graduated, and to make them do more and organize them in a different way to try and fill in the gaps. Now, having said that, I have used this opportunity again to appeal to resident doctors who are going on strike to return to work. This is not a good time to go on strike. I'm a doctor myself, and I can tell you that I want to be paid for what I'm doing. And in so far, it is justified that you ask to be remunerated. But the reasons why it hasn't happened are various. There are many, and there are myriad, and only a few of them are actually within the Ministry of Health here. Some concern state governments, which we cannot answer for. Some are matters domiciled in other ministries and departments and agencies, which we are not immediately responsible for. But whatever the responsibility, I believe that these are things we can iron out in negotiations without necessarily dropping work, because if any person loses his life in that respect, you can bring that life back. And whereas we can give you your money if we have underpaid you, or if you have been deprived of a promotion, it can always be corrected. But the other side of the coin is that if a person loses their life and is traceable to the fact that doctors were not there, we can't reverse it. So I'm urging them once again to review the use of strikes as a tool in handling complaints that they have. We shall work very well with them to see that everything is resolved. It may take a bit more time, but they need to come back to work, so that we do not begin to worry about our reputation as doctors who care more for our money than for the lives of others.
With the occurrence of the third wave of COVID-19, can you give us an update on immediate and long-term preventive measures by the ministry, especially also in relation to vaccine distribution and administration to Nigerians across the country?
Yes. Okay. The third wave is just another part or type of the COVID threat that we face. The first thing we must bear in mind is that this may not be the last wave, because it seems to be something that is recycling and coming up in cycles. So we must not fix ourselves to the third wave as being the last. and we must not congratulate ourselves before the race is done. So the tools we have at the moment are the following. First, that we want to reduce any importation of the virus into the country. So we have strengthened our borders. We are doing surveys on land, air borders, and even sea borders. And we have been able to, in fact, identify positives coming in by land border and also positives coming in by sea. And those coming on by air, of course, are all mostly discovered before they enter our country. Now, those who are here already, who are told, are encouraged to quarantine in their homes so that they get over and they are well. So far as they are well, they are not very ill, so they do not have the opportunity to spread it around. For those who are sick, they go into hospital, and those who are coming from particular countries we call the alert countries, they go into supervised quarantine. So all that is to reduce the rate of transmission, and of course we should do contact tracing. Who has each person been in contact with, and that person goes into isolation, or rather into self-isolation or quarantine depending on their condition. The third part of it is the question of the case management. So those who have become sick will be treated. They go into a treatment center, which we're improving every day. Most of what we need now is just observation and provision of oxygen and some medication which they get. So long as they appear early enough, the chances are good. But we'll keep broadcasting that once you suspect you may have COVID, go in time. The earlier you present in the treatment center, the better it is. And finally is a question of vaccination. So which we are driving. We receive 4 million doses at a time, and we exhausted those 4 million doses on the 8th of July. So we have just received more consignments now of various types of vaccines which have been deployed. They're already being used all over the country, in all states, 36 states and Federal Capital Territory. And we're urging all Nigerians to come out and take their vaccination. Those who are above 18 years old, those who have prevailing ailments. We want to encourage our citizens not to be influenced by the social media at all, because many of these countries where you have those who are hesitant have already vaccinated their population. In America, for example, they are probably 60 or more percent, or 68% vaccinated. In the UK, even higher. Some countries are already giving what they call a booster dose. So if within those countries you find 1 or 2% of people who are going to social media and discourage the vaccine use, it will not be wise of us to listen to those people.
Has there been any attempt to try to discover a solution to COVID-19, looking at from a local perspective?
At the time of the outbreak, there was a huge wave of people who said that they had the answer to it, and many sent samples. Remember, there were the Madagascar herbs, and there are others who have sent, I'm talking about Nigerian ones, who have sent various concoctions who they packaged and posted, and they were all sent for analysis at the Institute of Pharmaceutical Research. Some of them were sent to NAFDAC also and were tested, but they were not found to have efficacy. But we have not stopped. We are continuing to look at what could come out, because even most medicines that you take nowadays, including quinine, they all came out of plants at one point or the other. To answer your question, yes, we are looking at traditional medicine also.
Minister, there is a serious cholera outbreak, especially in the northern part of the country, and it's quite devastating and ravaging. What are the various proactive efforts your ministry has taken so far to try to address this challenge?
The case of cholera actually could easily be overcome if certain steps existed before persons became ill. Cholera is a waterborne disease. You have to have taken in raw water that contain the germs and become sick. Problems around it are first open defecation, and secondly the use of raw water. So we are working with Ministry of Water Resources, also with Ministry of Environment, to find answers that are beyond providing medicine and antibiotics, to prevent the number of cases of cholera that come up. So it's a lot of water hygiene, sanitation. We are working very well with the states to drive that part of it, to educate the people. We are looking for water purification tablets to send. Those are immediate measures. But the long-term measures is to take up the hygiene aspect, the water management, and the education of the people. So again, with more knowledge, children should be prevented from going into ponds and puddles to play and risk infecting themselves. So we are working with state governments, we are working with partners to educate the people, and also the minimum we can say is that before you drink water, boil it. Because if you boil the water, you kill the germs, or you can treat it. There are special tablets which we are trying to source from partners for the water you want to drink.
What is the policy direction of the ministry towards providing quality primary health care delivery for Nigerians? Are there challenges in this regard? What are the significant achievements that have been recorded in line with the WHO standard?
This topic you brought up is the flagship initiative of this administration. And the primary health care brings access to health care to the majority of Nigerians. We want to bring health care to the people first to reduce the distance they have to go to get health care. And secondly, the cost of health care. Even the cost of transportation already discourages many people. Primary health care can handle up to 60% of the entire disease burden that we have to deal with. Entire 60%, that's the majority. So it is the most important aspect of health care. And it also doesn't cost that much because you need perhaps one doctor or a few nurses and community health workers and a lot of education to go on at that level. So education is part of what you provide at the primary health care center on antenatal care. What kind of nutrition? Because a lot of malnutrition comes from ignorance, not from lack of food. So if people are educated, that is a perfect platform. Also, water hygiene. We're talking about cholera now. So if you have education going at primary health care centers, they will know already how to deal with the water they drink. And then immunization. If you are to be an excellent center to give a vaccination to all the people who come in there. Because there's mass drug administration for HIV. People who are on treatment for HIV, you don't have to go into town or into the city to collect your medicine. For those who are in treatment for TB, those who are in treatment for neglected tropical diseases. And according to the program that the government is setting up now to make basic healthcare affordable and available to everybody, even things like diabetes, hypertension can be diagnosed at primary health care. So it's part of the basic minimum package of health care that the government is preparing, supported by the National Health Insurance Scheme, and also that will benefit the pharmaceutical sector, because the pharmaceutical sector will be supplying all these drugs to primary health care centers, and so that the pharmaceutical industry can grow accordingly to this demand that we are going to be creating.
We'll be speaking with Dr. Osagie Ihanire, the Minister of Health. The Minister platform will continue in a moment after this time out.